Stress causes nothing, but it precipitates everything. So as I said, I've been doing this job for 46 years. I've not seen one person who's had a heart attack, stent, bypass, stroke, who wasn't under some form of stress at the time. But the general public typically has a misconception about stress. They think stress is some emotional thing. That's one form of stress. So, for example, within 2 hours of you getting acutely angry or anxious about anything, you increase your risk for a heart attack.
Hello and welcome to the Biohack Her podcast. I'm Azra Ulagich, your host and founder of Biohack Her. I'm an integrated nutrition health coach specializing in longevity for women, a health and wellness journalist, writer, corporate consultant, and a biohacking advocate. Biohack Her is a space where we can explore ways to optimize our health to live well longer. Whether it's through improving our nutrition, exercising, cryotherapy, supplementation, technology, and more, I'll be bringing you information and interviews with the best longevity experts to help you understand what you can do to optimize your health, prevent disease, and slow down or even reverse the symptoms of aging by taking control of your unique bio-individuality. Want to know more? Let's dive in. Hey guys, before we jump into the next episode, I wanted to take a quick moment of your time to tell you about the next Live Well Longer retreat that I'll be co-hosting with Camilla Thompson. If you've been feeling the pull to pause, reset, and reconnect with the woman you're becoming, then this is your moment. Join us for the next Live Well Longer retreat, which will be held from the 1st to the 6th of May in 2026 at the beautiful Reviva Resort in Bali. This isn't just a holiday. It's a transformational experience designed to help you reset your biology, restore your balance, and reimagine what aging well truly means. Across 6 days, you'll immerse yourself in restorative practices, nourishing food, movement, workshops, deep rest, and soul-level connection with a community of like-minded women who are all committed to living well longer. It's the kind of retreat that stays with you long after you return home. The clarity, the shifts, the confidence, the reconnection to your healthiest, most grounded self. If you're ready to invest in your well-being and step into a new chapter feeling renewed and inspired, I'd love you to join us. Register your interest now at livewelllongerretreats.com. Spots are limited. Now on to the podcast. Dr. Ross Walker, welcome to the Biohack Her podcast. You are one of Australia's most trusted cardiologists with over 40 years of clinical practice. Do you think that modern medicine is actually making people sicker and not healthier?
Oh, no, not at all. I think modern medicine has done some extraordinary things, and I think we're getting very close to things like curing cancer. And this one horrifies me, preventing heart disease completely, which will put me out of a job. But we are moving towards that. We're now developing a vaccination against heart disease, for example. Not available yet. And for all those anti-vaxxers out there, we're not talking about RNA vaccines against heart disease. But I'm just saying all of these things are being developed. Modern medicine is doing some wonderful things. And if you're having a heart attack, don't go to your naturopath. Get into a hospital and get a stent in your arteries. I'm not knocking naturopaths at all. So I think for acute problems, modern medicine beats any other area of health innovation. But the problem I have is the way that modern medicine's practiced has been practiced like this forever. We have the ambulance parked at the bottom of the cliff waiting for people to fall off. So instead of fixing the rails at the top, i.e. prevention, what we do in medicine is we build faster ambulances. And it's a bit like the financial world waiting for someone to go bankrupt, then they give them financial advice. So I believe the best treatment of heart disease, cancer, Alzheimer's, diabetes, osteoporosis, all of our modern killers is not to get them in the first place. It's called prevention. And unfortunately, this is where modern medicine does fall down. If you look at health expenditure in Australia, for example, I think it's around 0.5 to 1% is spent on prevention, whereas well over 50, 60, 70% of our health dollar is spent on people in the last 5 to 10 years of their life. It's just madness, absolute madness.
Why do you think that is? Why do you think there's such a discrepancy between where money is spent?
Oh, well, I think it's pretty straightforward. There's a few things. Firstly, politics works in 3 or 4-year cycles. So all politicians care about is what's going to happen in the next few years. So if you bring in preventative strategies, it may not have an effect on the health of the nation for 15, 20, 30 years. They don't care. They're not going to be there.
Mm.
So if you look at a place like Singapore, where they had Lee Kuan Yew, who had a 50-year vision, taking for Singapore from a mosquito-infected swamp to one of the greatest small cities in the world because he had a 50-year vision. But none of these politicians have a 50-year vision. But it's not just the fault of the politicians or the fault of the medical profession. It's also the fault of the public. The public are quite happy to abuse their bodies up to the day of their heart attack or the day of their bowel cancer operation or whatever. Now, if you had a absolute champion racehorse, the last thing you're going to do is feed that racehorse cigarettes and crappy food and stress the racehorse out of its brain. You're going to nurture that racehorse. If you bought a high performance motor car, you're not going to put garbage in the petrol tank. You're going to put high octane fuel, if you can get it these days, in the petrol tank, because you want to maintain the integrity of how that car works. But people abuse their bodies. So I talk all the time about the 5 keys of being healthy, which if when you talk about anti-aging, when you talk about prevention of disease, these 5 keys are 80% of anyone's management. And the 5 keys are very simple. Have no addictions, good quality sleep, good quality eating and less of it, 3 to 5 hours every week of moderate exertion, which tragically, Azra, only 25% of the population do, and only 10% of people over the age of 65 do 3 to 5 hours of exercise per week. Should be 2/3 cardio, a third resistance training. And most importantly, best drug on the planet, a thing called happiness. And most people are unhappy. So those 5 keys, what I call the 5 keys to being healthy, 80% of anyone's management, only 10% of people do. So they're not thinking about the next 5, 10, 15, 20 years of their life. They're just thinking about their next piece of entertainment, their next feed, the next piece of sexual activity. And I think we just have to really think there's a greater purpose to life. And one of the things is once you lose your health, then your life is really finished. You just spend the last, and unfortunately, a lot of people spend the last 10, 20 years of their life just going from one doctor's appointment to the next on a bucket of pills, thinking that's the answer. No, the answer is to get back to that 80%, those 5 keys, and look at the 5 blue zones around the world where they have enormous longevity. Okinawa in Japan, Ikaria in Greece, Sardinia in Italy, the Nicoya province of Costa Rica, and the Seventh-day Adventists living in Loma Linda. They've never heard of cholesterol-lowering pills or gyms. They just practice the 5 keys. They just have a stressless, a healthy life, strong sense of family, strong sense of community. They eat natural food, not the crap we eat in our society. They don't exercise per se, but they live on the side of hills and they're walking up and down the hills all day. They're moving, moving, and moving. They don't smoke. So that's the real essence, and people have lost that. So they depend on the medical system when they get sick. So it's not a healthcare system, it's a disease management system, and it works well when you've got the disease, but it doesn't return you to good health. It just stops you being acutely ill. That's the problem.
Yeah, and I completely agree with you, but do you think that in itself is the crutch of the problem? Because people are leaning on that crutch, that being they can go to the doctor, they can get a pill, to manage their blood pressure, whether it's diabetes, whatever it is, rather than actually looking at lifestyle changes or nutritional changes that could potentially reduce some of those symptoms or completely eliminate them, depending on where they're at. Do you think that they're leaning on that crutch too much?
Of course, because you know why? That's the easiest path. So I'll
Yeah.
give you a great example. The fat guy goes into the doctor and says to the doctor, "I've got cholesterol." And the doctor doesn't say to him, "No, you're a fat slob. You need to lose weight." The doctor says, "I can fix that cholesterol. Here's a pill, Lipitor." So a Crestor. And the guy walks out with his script and goes, "Oh, phew, I didn't get a lecture about being fat. I can just eat what I like and just take the pill," which is biologic nonsense. And the doctor goes, "Oh, phew, I didn't have to spend time talking to the person about lifestyle. I just gave them a pill, got rid of them." So everyone's happy. Everyone's happy apart from the taxpayer who's got to fund this through Medicare. And it's a very expensive way of dealing with so-called health matters. And they're not health, it's not a health matter, it's a disease matter. We've got to get back to realizing that we are the CEO of our own health. We should be taking responsibility for our own health. And you see, 3 to 5 hours a week of exercise is a big commitment. But I do 45 minutes of exercise every single day because I know it's the second best drug on the planet after happiness. And there's an unknown university in America called Harvard. And Harvard have been doing for the last 85 years a thing called the grant study. And the grant study shows beyond a doubt the one key to health and happiness is to have someone else in your life who loves and cares for you, who you love and care for. Much more important than your damn cholesterol levels or your blood pressure. So, what we should be doing is learning to nurture our relationships and to go through your life with the attitude, which many people don't have because they're takers, the attitude, how may I serve? What can I
Mm.
do to make your life better? So with your primary partner, the person who you spend most of your time with, give most of your emotion to, care about them, love them. It's the most selfish thing you can do for your health.
So, if most chronic disease is preventable, why are we seeing more of it, not less? Who's to blame? Is it the individual? Is it government? Is
Uh,
it
It's
education?
all of us, apart from the 10% of people who practice the 5 keys. It's all of us because it's the easiest option. Because we just think, oh, I'm hungry, I've got to eat. And we all eat more food than we need to. And this is the problem. Oh, people say, "Oh, doc, but I get starving at 10:30." Get over it. The body was meant for a bit of hunger. You see, physiologically, we were designed to live only for 30, 40 years wandering around a jungle with a spear. So you'd kill the beast, eat it straight away because there's no prehistoric Kelvinator, and maybe go 2 or 3 days without a big feed. So eat some nuts and berries off the tree and drink some water and use your legs all day to do it. We don't live like that. Breakfast, lunch, dinner, sit in our bums all day. And that's the structure of society. So it's no one's fault. It's just the habits we've gotten into, and everyone's just gone along for the ride. There's no big conspiracy to make people ill. It's just the way human beings are. It's really interesting. In the 1930s in America, there was this group of people called Pima Indians, these svelte young men running around the American wilderness. Then they put them all in reservations. Now, the Pima Indians have the highest rate of type 2 diabetes and morbid obesity in the world. 60% of them are type 2 diabetics. The average type in Australia, it's about 7 to 8% type 2 diabetics. But in the Pima Indians, 60% because of their genetics. Now, this is the thing. It's your genes that load the gun, it's your environment that pulls the trigger. So 30% of Caucasians are born with the gene for insulin resistance. 50% of Asians and 100% of people with darker or olive skin have that gene. So when you take someone with that gene and put them into Western society and feed them Western rubbish and Western inactivity and Western stresses, they get severe diabetes, morbid obesity, et cetera, et cetera. And so it's a combination of your genes in this environment.
Yeah. You mentioned about the reactive approach that our medical system has. Do you think that our healthcare system is too focused on managing disease
Of
or
course.
rather than preventing it?
Of course it is. And that's where the emphasis is. Look, I've been in the preventative healthcare space now for 30 years of the 46 years that I've been a doctor. And it's a hard sell. And it's not just a hard sell to governments, it's a hard sell to people. Yeah, and I've got two groups of people in my practice. I've got people who listen to my advice, that's 10%, and the people who don't. And you see these people, I've had the conversation with them, Azra, about eating less food, doing more exercise, et cetera, practicing the 5 keys. They come back 12 months later, 2, 3, 4 years later, haven't lost a scrap of weight, typically put weight on. I saw a woman the other day, real lovely, lovely human being. But she said, "Oh, doctor, after I saw you, I lost 15 kilos and I felt wonderful. But then all these stresses happened in my life and it's all come back on." And that's the point. John Lennon once said, life's something that happens when you're busy making other plans. And so people get stressed and just think about how stressed and complex our life is. We're woken up every morning by a thing called an alarm clock. So the alarm starts. "Ah, ah, ah, ah." You get out of bed, you think, "Oh, gee, what have I got to do today?" And you're thinking about all these stressful things. The travel to work is stressful. People have complex jobs. They have complex relationships. We were designed just to be top of the food chain stuff. The only stress we had was the acute stress of the kill or the stress of avoiding being something else's lunch. That was it. But now we have stresses coming from everywhere. We have stresses in our families, stresses at work, stresses with travel, as I've said, and then all the geopolitical stresses we're now suffering from all over the world. Many people, well, all of us have come through the horrible COVID pandemic, 3 or 4 years of that nonsense where we're all stuck in our homes, not allowed to go out of our suburbs. And I think people are traumatized by all of these things. And so we're not leading the simple life we're supposed to be leading like they do in the blue zones.
Yeah. Is it that people are using stress as a reason to indulge in a negative way? Or do you think that stress is a significant, well, we know that stress is a significant contributing factor to how we age. Um, but when we think about how we manage stress, so many people, I feel, just tend to not manage it in a proactive way. They just tend to accept the fact that, "Oh, I'm stressed about that email. Oh, I'm stressed about the geopolitical situation. Oh, I'm stressed about my relationship," without actually trying to find solutions. What are
Yep.
your thoughts on that?
Oh, look, I think there's a whole it's a huge subject. I'm happy to go through it first. But firstly, let's just go back to what stress does. Stress causes nothing, but it precipitates everything. So as I said, I've been doing this job for 46 years. I've not seen one person who's had a heart attack, stent, bypass, stroke, who wasn't under some form of stress at the time. But the general public typically has a misconception about stress. They think stress is some emotional thing. That's one form of stress. So, for example, within 2 hours of you getting acutely angry or anxious about anything, you increase your risk for a heart attack 8 times. 8 times.
8 times,
Yeah,
wow.
yeah. So what I'm saying is your genes are putting the fatty plaque there in the wall of your arteries that's sitting there like a big pimple doing nothing. You stress it, you poke the bear, it ruptures into the artery, causes a heart attack. So you've got an 8 times higher risk once you get anxious, once you get angry. So it's our job to try and control our anger, control our anxiety, so we don't poke that bear. But number two is mental stress. You're under the pump at work, you've got deadlines, and I see stress a bit like a garbage bin. So you keep putting the garbage in the garbage bin. If you don't empty it, which is what you're inferring, if you don't empty the garbage regularly, the garbage starts to flow over the sides of the bin. So if you've got a huge amount of stress, you're throwing the garbage in quickly, so it's much quicker for the garbage to flow over the bin, or i.e., you're starting to feel the symptoms of stress. So we have to develop techniques that will allow us to empty the bin regularly. So, one example there, I've been meditating every day. I did it this morning for the last 35 years. And there's no doubt from all the studies that regular meditators have a 50% reduction in cardiovascular disease, cancer, but also you think better, you feel better, and you cope with stress better if you have a meditation habit. So, there's mental stress. Number three is physical stress. So again, we see these lunatics who go exercising when there's bushfires or when there's heavy pollution around or during extremely hot days or extremely cold days. So doing excessive exercise during extremes of environmental stress is very, very bad for you as one example. Then there is pharmacologic stress. And people don't think about this. Legal or illegal drugs can
Mm.
stress the heart and rupture plaques in your arteries. One example, I had a guy in his 30s with a very strong family history of heart disease, went out on a bucks night one night, had a few lines of coke, wiped out half his heart from a major heart attack, as one example. Now, these fools who think marijuana should be legalized, and I'm a strong supporter of medical cannabis, different thing. But you smoke one joint, you increase your risk for a heart attack 5 times. Now, why? Because the heavy concentration of THC, which is the tetrahydrocannabinol, which is the thing that does your head in when you smoke a joint. I've never smoked a joint, but the thing that does do your head in when you smoke a joint, damages the lining of blood vessels called the endothelium and can help rupture plaque. So any illegal drug or even legal drugs. A heavy night on the grog can rupture a plaque, as an example. I had one guy, a 35-year-old, thought it was a good idea to have 3 double shot cappuccinos in an hour, sent his heart into overdrive atrial fibrillation, developed a cardiomyopathy. So pharmacologic stress is important. And then finally, we've already mentioned it, is any sort of infective stress. So we've just come through the COVID pandemic, but influenza, RSV, pneumonia, urinary tract infection, all of these stressors can precipitate a problem. So there's all of these background stressors that we're all exposed to all day, every day in different forms. There's always respiratory viruses going through the community, and there's always temptations to overdo the illegal drugs or the legal drugs or whatever. You're a bit stressed, so you go to the grog as an example. So I don't think it's an excuse. I don't think stress is an excuse. I think stress is a precipitant that pushes people in a certain direction. And there's two aspects to this. When you are stressed, you're releasing the unhappy chemicals, cortisone and adrenaline, but also when you're stressed, you are less likely to sleep well. You're more likely to abuse the legal and illegal drugs. You're less likely to eat well. You often go for the comfort foods, the foods that are bad for you. You're less likely to say, well, I'm really stressed and I don't feel great, but I'll still go and do my exercise. And also, finally, when you're stressed, you're more likely to take it out on the people who really matter in your life. And so, therefore, you break down your relationship. So I think that's my overview of stress. And I think really, when you have an acute stress, you've just got to go through it. There's no magic when something horrible happens in your life. But I think we all have to have techniques we use every day that will minimize the stresses, such as meditation, breath work, yoga, all the things that are really important, and exercise. I mean, I just over my left shoulder here is my exercise bike. I played sport from the age of 5 to 52, destroyed my right knee, so I had to give up the old fart soccer I was playing and squash. But I have broken 4 exercise bikes in 18 years of since I did my knee in from overuse. Now, most people use an exercise bike as a clothes hoist. Now, I'm not saying, "Aren't I wonderful? I do exercise every day." I'm just saying I've disciplined myself. I've made the commitment because the 2 success principles in life are discipline and perseverance. Yeah, 12-week programs, who cares? They don't work because at the end of the 12 weeks, you stop. You've got to have a lifelong program where you make these commitments to stress management techniques like meditation, to exercise techniques, to eating well, to not smoking, to keeping your grog down, not using illegal drugs, and cultivating a good sleep habit. All those 5 keys I speak about.
Mm. You've touched a little bit on heart disease, and I'd like to do a little bit of a deeper dive into that. The Heart Foundation says that heart disease is still one of the leading causes of death for women. Why do
Yep.
you think we haven't got on top of this yet?
Well, firstly, can I say now, tragically, the leading cause of death for women is Alzheimer's disease, which is dreadful. Heart disease comes in a very, very close second. We haven't got on top of it because still only 10% of people practice the 5 keys. We've got terrific treatments for cholesterol with the statins if you need them, and statins are overprescribed for a lot of people. We've got wonderful blood pressure treatments. We've got good management of diabetes. But if you think about it, I talk about 80-10-10. 80% is lifestyle, 10% is orthodox medicine, 10% is the use of evidence-based supplements. Now, the orthodox doctors are only focusing on that 10% of medical therapy. They don't talk to people about lifestyle. I mean, most people listening to this podcast, how many doctors have you been to where they actually spoke to you about how good it is for your health to improve your relationships? Hardly doctors don't have the time to talk to people about this. It's one of the things I focus on in my own practice, but that's 80%. But if you're only focusing on the 10%, which is the orthodox medical therapies, you go into hospital, have your heart attack, you get a list of drugs you come out with after your heart attack, after you've had the stent in, but there's no focus on the 80%, and orthodox doctors don't believe in supplements. So you're getting 10% of therapy. That's why I think we're still seeing the carnage from cardiovascular disease, cancer, and now tragically Alzheimer's disease.
Mm. Are women being misdiagnosed, or are we using the wrong model of heart disease
No, I
entirely?
think, look, 20, 30 years ago, yes, absolutely. These days, no. If you avail yourself of a good doctor, male or female, and referred off to a good cardiologist, male or female. Everyone's very focused on everyone's health. It's not, women aren't being ignored anymore. They used to be. There used to be this nonsense that women had less heart disease than men. Women have just as much heart disease as men. They only typically get it 10 years later because you guys are protected by your hormones up to menopause. Then you lose the protection. But no, there's also some very specific cardiac disorders that are much more common in women than they are in men. I'll give you one great example, and I'll give you the reason for it as well. There's a thing called Takotsubo's cardiomyopathy. Now, Takotsubo's cardiomyopathy sounds very esoteric and rare, but it's pretty common. And basically what it is stress-induced heart disease. Now, why does it affect women more than men? Not because women don't cope with stress as well as men do, because it's totally different, of course, but it's because women have smaller arteries than men. So when you get stressed, the adrenaline can constrict those smaller arteries to be even smaller and cut off the blood supply to your heart. So what happens, you have some acute severe stress, and we all know that the worst stress anyone can go through is the death of a loved one, marriage or infidelity, moving life. That's so you go from you typically you might live in Sydney, you might decide to go and move to Brisbane or Melbourne or whatever, but just that moving and having to relocate somewhere else is a huge life stress. So just say you have one of those life stresses and it's really getting to you. As a woman, you can have this acute episode, looks like a heart attack, severe chest pain. The blood tests say you've had a marker for a heart attack, a thing called a troponin rise. You go in, they do an angiogram, your arteries are whistle clean normal, because by the time you've got to the hospital and the things settle down a bit, your constriction in the arteries is gone. That's 80% women, 20% men, as one example. There's another condition called MINOCA, which is myocardial infarction or heart attack with normal coronary arteries. Because here's the thing, everyone thinks the coronary arteries are just the big tubes that supply the heart, or the carotid arteries going up to the brain. Yes, they're the big tubes. They're like the big pipes coming out of the dam. But then there are the branch vessels in your street, the smaller pipes, then the tiny pipes in your house and the tap. That's the microcirculation, which we can't see on an angiogram. That can still be defective and give you the same symptoms of a heart attack without having any evidence of blockages.
What are your thoughts on cholesterol? We've been told for decades that cholesterol is the main driver. How much of that is actually true?
Oh, well, a quarter of it. Let me explain to you why. Total cholesterol means nothing, absolutely nothing. So a thin young woman like you, Azra, if you went to a doctor, your cholesterol might be 7, your HDL could be 2.5, triglycerides low at 0.6. The doctor says, oh, your cholesterol's high, go onto this statin pill. But then you go off and have a coronary calcium score, which takes a picture of your arteries, and your score is 0, which yours probably would be. And so you have a 0 calcium score, but a high cholesterol. You're what we call a lean hyperresponder. And here's the essence. Cholesterol isn't just cholesterol. It's divided into 4 bits: small LDL, small HDL, large LDL, large HDL. And here's where size is important. The larger your LDL, the larger your HDL, the healthier it is for you. So lean hyperresponders with a 0 calcium score, so nothing in their arteries, but a very high total cholesterol, but a high HDL, low triglyceride, they have a lot of large LDL and large HDL. So let me explain to you what each component does. Small LDL puts fat into the artery, so you don't want that. That is the major cause of heart disease. Small oxidized LDL. Small HDL is pro-inflammatory, so it inflames those arteries. Not good as well. Large LDL, we all need it. Large LDL builds a healthy brain, healthy cell membranes, cell communication. It's the basic ring for bile salt, vitamin D, and steroid metabolism. So we must have large LDL, and large HDL sucks fat out of your arteries. So we need those two larges. We just don't need the smalls. And that's the thing. What statins do, they just lower LDL indiscriminately, lower cholesterol indiscriminately. Doesn't say whether it's lowering the large or the small. So statins are overprescribed for people who don't need them. Now, who does need statins, in my view? The 10% of therapy. Everyone needs the 80%, of course. But who needs the statins? People who've already had heart attack, stent, or a bypass, or they've had a coronary calcium score, which I pioneered in 1999 in conjunction with the Sydney Adventist Hospital in Wahroonga in Sydney. We brought that into Australia. And this coronary calcium score is a CT scan that takes a snapshot of your arteries. No dye, no injections. There's a thing called a CTCA done on the same machine. It's not a screening test for heart disease. It's only the calcium score. And if your calcium score is 0, you should be congratulated, not medicated. If your calcium score is below 100, you're still in low risk. You still don't need a statin. Once your calcium score gets above 100, that's when statins should be part of your management. So that's how it all works. So cholesterol is that straightforward. You just look at the pattern. So, for example, you have a blood test. Your cholesterol might only be 5, which a lot of doctors say, oh, that's okay. But your triglyceride level, another fatty component, might be 2. It's double normal. Your HDL, so-called good cholesterol, might be only 1 or 0.5 or 0.7, 0.8. That's very low. And so therefore, that's a marker for how much small LDL, small HDL you have, which is the bad pattern. So most doctors don't even look at this or think about that. They just say, oh, cholesterol's high, go on a pill. It's
Yeah.
absolute nonsense.
Yeah, absolutely. And I've seen that happen with my husband, actually. Do you think that statins, do you think that they're a life-saving drug, or do you think that they're overprescribed as a safety blanket?
They're overprescribed. They're not life-saving, but they are an extra layer of benefit for people who are at high risk. But see, I think that the public gives statins far too much pain, and the medical profession gives statins far too much power, and I think the answer is in the middle. Statins are very useful drugs if used properly. And here's the thing, people, I find this absolutely bizarre. People come to me and say, oh, doctor, I don't want those statins. Why? Well, because of all the side effects. Have you ever tried them? No. Well, some people, yes, I've tried them. They causing you side effects? No. Well, what are you worried about them for? Because of the side effects. I mean, it's a ridiculous argument. 80% of people that take statins don't get side effects, and they get the extra protection if they've got muck in their arteries. But if you don't have muck in the arteries, don't even worry about your cholesterol. That's what I'm saying. I don't treat cholesterol at all. I treat risk. So I do an assessment of someone's level of risk, then I treat them. And so therefore I may or may not use a statin base. So I spend half my week taking people off statins, the other half putting them on them, who should be on them.
Sure. What about inflammation, though? Do you think inflammation is something we should be worrying more about than cholesterol?
Absolutely.
Yeah.
Because as I said, all disease is genetic, and under genes is inflammation. So basically, inflammation is caused by something that shouldn't be there in the first place. So what shouldn't be there in heart disease is small, dense, oxidized LDL cholesterol. And what causes that? Inflammation. And so what is inflammation? I'll explain to you. It's a pretty simple thing that there's your arteries like this, and coming through the arteries are our nutrition, oxygen, etc., which have to get into the tissues to do their stuff. But here's the thing. We were designed to be hunter-gatherers, as I've already said, and hunter-gatherers were basically a bit malnourished walking around the jungle looking for food. So really our lifelong cholesterols should be well below 3 in terms of what our physiology expects, because we haven't evolved much past those 10,000 years. But now, breakfast, lunch, dinner, sitting our bums all day, almost everyone living in our society has cholesterols well above 3. So anything above 3 that you don't need may, not does, may spill into your arteries. So when a bit of oxidized LDL spills into the wall of the arteries, one of the white cells called the macrophages, which are our foot soldiers that go around like security guards looking for things that shouldn't be there, sees this bit of small, dense LDL in the wall of the arteries. The macrophage follows it in, chews on it, and then the macrophage goes, gee, that tastes nice because it's fat. So they choose on more and more and more, and the macrophage, like human beings, gets fat, what we call a foam cell. The foam cell gets so fat, like the guy on the Monty Python Meaning of Life thing, got so fat he exploded, and so that explodes in the artery. More macrophages come in and start chewing on that, more macrophages, and it just becomes a vicious cycle. That is chronic inflammation. That's exactly what happens in chronic inflammation. So that's a vital part of the formation of fatty plaques in the wall of your arteries. So not only should we be focusing on lowering cholesterol in people who need their cholesterol lowered, not everyone does, we should also be focusing on the level of chronic inflammation in people's arteries. So there's a very good simple test we do in cardiology called HSCRP, which stands for highly sensitive C-reactive protein, which is a very good non-specific marker for how much inflammation is going on in your body. And if your CRP levels are consistently below 1.5, you have minimal inflammation, your immune system's working very well. And so we monitor people in cardiology by looking at their HS-CRPs. Now, if I've got, say, typically this happens in people who are overweight or obese, their CRPs might sit at 3 or 4, so they've got mild background chronic inflammation. I will firstly, obviously, have a talk to them about losing weight. I might put them on some natural anti-inflammatories. But for example, if you had acute COVID during, to quote the Donald, and I don't like quoting the Donald, but during the initial China virus, the Wuhan strain, um, I'd see people come in with COVID who had CRPs of 350. So anything above 5 is abnormal. Anything above 1.5, I think, is not good, but above 5 is abnormal. But 350, if you've got a bit of a sore throat, your CRP might go up to 10. If you've got acute leukemia, it might go up to 100. Polymyalgia rheumatica, it might go up to 100. So we use the CRP as a good marker for chronic inflammation. And chronic inflammation to me is under genetics, chronic inflammation, which then leads to everything. Now, interestingly, my colleague David Sinclair, he talks about aging as being a disease that is preventable and treatable, but I think aging is the start of all of our degenerative diseases because we're not supposed to be here over the age of 40. So when you hit 50 and the hormones go south, which they do in men and women, then all the degenerative diseases start because aging starts. So it's genes, chronic inflammation, aging, then all of the diseases that come from it.
Mm. I'm interested to hear your thoughts regarding the early warning signs of heart disease in women and whether that's still being missed at the moment.
Yeah, well, you see, the thing is men are very unidimensional. Men get the Hollywood heart attack, which is the crushing central chest pain going up to the throat, down the arm. Very easy to diagnose, very easy to treat. Whereas women tend to get more diffuse symptoms. Often they still get discomfort in their chest, but it mightn't be crushing central chest pain here. It might be a bit of a niggle over the top of the breast, or it might be something in the shoulder or down the arm. I've even seen that in men as well, of course. Not just this isn't just exclusive to women, but it could be just unexplained shortness of breath. It could also be a feeling of marked fatigue. Now we all get tired, but I'm talking about really intense fatigue that can really bring this out as well. Lightheadedness, and there's so many vague symptoms that most of us get many times a year, which we ignore. But what I'm saying is, if anything new happens, men or women, that you've never had before, like the niggle in the chest, like the shortness of breath, like the extraordinary fatigue, or even a bit of nausea or whatever, go off and get it checked with your doctor. So I say to my patients who are established patients of mine, I say, I never want to hear you've had 3 months of anything. A day or two I'll accept, but not 3 months. Or if you're sitting at home one Friday night getting crushing central chest pain, you don't think, oh, I better ring my doctor on Monday. That's triple O and get to a hospital.
Yeah. Yeah. Do you think that menopause fundamentally changes a woman's cardiovascular risk, or is that overstated?
Of course it does. Of course it does. And in fact, and I'm not an expert in menopause at all, but I do have an interest in it because it's so important to how everyone's body functions. But women go through these phases in their life, as you're well aware. You go through puberty, and again, this is how physiology, and I don't want to make any politically incorrect comments here, but this is how physiology demands, we don't live 30, 40 years. So a girl would have her periods 10, 11, 12, and she'd be pregnant within a year or two. So the best physiologic time to have a baby, and it doesn't fit our society, of course, is about 15 to 25. 25 to 35 is okay. After 35, it becomes much more difficult, which is why many women then avail themselves of IVF in their 40s. And I won't go into that, nor give my opinion about it. But that aside, I think there is a very long premenopausal phase up to age 50 that starts at 35. So a woman's body changes then, and then risks for cardiovascular disease start to increase from 35, and they start to go just the same as men over the age of 50. And so it's the loss of hormones, and it's also going with that, and we haven't even mentioned this, but there's a very strong link between almost everything in the body in gut dysbiosis. So often around the time of menopause, because of 50 years of living, your gut bacteria are changing as well, and that can feed a lot of menopausal symptoms, women that have gut dysbiosis. So it's a very complex story. And look, 20 years ago, there was this absolutely stupid study done called the Women's Health Initiative, where they basically started women on HRT often 15 to 20 years after the end of their periods. So 15 to 20 years post-menopause, they'd start them on HRT. And what a shock. The women who did it had a higher rate of breast cancer and heart attack and stroke, because you don't flog a woman's body with hormones 15, 20 years after the event. If you're going to start HRT, it's been shown beyond a doubt it's very safe, it's very effective for many women, not all women, if you start it as soon as they start to get the symptoms. But don't then introduce it 15 years later. And I've got a number of patients who have been on HRT for 15, 20 years since menopause, and their doctors have said, "Oh, I think you've had enough of that, you can stop." Within a month of stopping, their life has become a misery. So I'm a great supporter of HRT, not heavy pharmaceutical HRT, but more the biologic types of HRT, which I think are quite effective.
Mm. So if a woman is starting to experience that from 35 onwards, what should she be doing to future-proof her heart? What should she be prioritizing first?
Well, always, Ezra, I might sound like a broken record, but those 5 keys, that's the most important thing. And don't go for the supplements or the bioidentical hormones, but not practice the 5 keys. And I'm a great believer in supplements. I'm a great believer in bioidentical hormones, or more biologically based hormones rather than pharmaceutical grade HRT. But if you practice those 5 keys, that will give you the best chance. And then there are some herbal preparations, and I'm not an expert in that area, that you can talk to your integrative GP about, that may also help. But it's mainly the 5 keys. Because the problem is when the woman hits 35, and men as well, the metabolism starts to change a bit and it becomes so much easier to put on weight. And also, there's often kids around, and especially mothers spend all their time devoted to their children, and that they lose a little bit of the self-centeredness where they should be devoting a bit of time to themselves as well, because that's when the weight starts to come on. And then becomes a vicious cycle of weight and estrogen imbalance and progesterone imbalance because of all of these things. Well, look, the true pandemic of the 21st century is not COVID. It is diabesity. And diabesity being the combination of diabetes and obesity, which occurs in so many people, especially women, once they've gone beyond 35.
Mm. We touched on this offline prior to starting the recording, but I would like to get your take on popular health advice. Low-fat diets, which was something that we touched on, step counts, cardio obsession. What are we focusing on that's wrong?
Look, one of the things that really does my head in is when still major organizations come out and still say we should be limiting our intake of saturated fat. Recently, the FDA in America put out a new food pyramid where they're encouraging people to use saturated fat, but no more than 10%. I mean, it's just quite bizarre. Now, I'm not saying people should swim in red meat, but there was a study, the best epidemiologic study in the world was released about 10 years ago, called the Pure Study. And the Pure Study looked at 220,000 people, followed them for 9 years in 50 different countries. When they analyzed the data, those who had the highest intake of saturated fat, meat, dairy, and eggs, these people had a 25% reduction in all-cause death and cardiovascular disease compared with people who had the lowest intake of saturated fat. So people who still believe this nonsense are the ones who I think doing harm to themselves. But you think about it, if leading institutions around the world came out and said, like American Heart Association or National Heart Foundation or whatever, whoever it was, and look, I'm not knocking the National Heart Foundation, it's a wonderful institution. But if they come out and said, look, for 50 years we've been wrong about saturated fat, we're reversing our advice, the public could lose faith. So they've got to keep the mantra going. But there is no evidence at all that saturated fat causes heart disease. What causes heart disease diet-wise, as far as I'm concerned, is firstly the fact that people are becoming more obese because they're eating more ultra-processed foods and they're having more refined carbohydrates, what I call white death. sugar, any form of sugar, white bread, to a lesser extent, pasta, potatoes, rice, goes straight to the gut, increases your risk for insulin resistance. So, and people say, oh, you should read the food labels. If you can write the food labels on a food, it's not a food. It's useless calories that are doing nothing for you at all. So the more we eat natural foods, and here's a tragedy, only 5% of the Australian population have 2 or 3 pieces of fruit per day, 3 to 5 servings of vegetables per day. 5%. And
It's
those who
crazy.
do have the lowest rates of heart disease, cancer, Alzheimer's, and it doesn't do zip to your cholesterol. What it does is damp down, as you've so rightly said, Azra, damps down chronic inflammation by having the fruits and vegetables. So again, don't take buckets of supplements if you're not having your fruits and vegetables. So really the only diet that has any sort of long-term evidence base is the Mediterranean diet and all of its spin-offs, like the DASH diet for hypertension and vegetarian style diets. But the Mediterranean diet's nothing flash. It's just the fruits and vegetables I mentioned. And on top of it, little bits of meat, eggs, dairy, chicken, fish, nuts, and olive oil, and none of this refined carbohydrates or ultra processed rubbish.
Yeah,
So that's
absolutely.
the dietary part of it. You wanted me to talk about steps.
Yes.
Now, again, steps. The whole thing about steps is we've been told for years we've got to do 10,000 steps a day. What nonsense. Absolute nonsense. There's no evidence. It's like you've got to drink 8 glasses of water a day. The only people I know who drink 8 glasses of water a day on top of everything, they're always sucking on these horrible plastic bottles and getting all the microplastics into their circulation. So the only people I know who drink 8 glasses of water a day spend half the day in the bathroom. It's just absolute nonsense. So the 10,000 steps a day, there's no evidence for it. In fact, the evidence shows that if you can do somewhere between 4 to 7,000 steps a day, then that's healthy for your body. But again, I don't get anywhere near that because I sit my bum all day seeing patients.
Mm.
So I do my half an hour on the exercise bike every day, which is much more than 10,000 steps. So I'd cycle for about 15, 16 kilometers for a half an hour every day. And so it's better than 10,000 steps. So people say to me, Ross, what's the best form of exercise? It's not cycling, it's not walking, it's not swimming. The best form of exercise is one you'll keep doing. I don't care what it is, whatever exercise you'll keep doing. And tragically, only 25% of people do that. So develop an exercise habit that works for you. So I don't like gyms. So I've never go to a gym, but I think gyms are great for some people. I mean, I like swimming when it's hot, but I'm a useless swimmer. I'm just very comfortable sitting on my bike. I don't go, wow, I'm about to sit on my bike for a half an hour, but I've developed a habit where I do that. So just develop a habit to exercise, but don't get there and feel guilty if you've only done 3,000 steps that day, if you've done your half an hour exercise somewhere else.
Yeah, it's gotta be sustainable, doesn't it?
Yeah,
Mm,
absolutely.
yeah.
Absolutely.
So we've touched on nutrition, we've touched on exercise. Let's go down the pathway of supplements for heart health.
Yep.
Is there such a thing?
Oh, absolutely. In my view,
Yeah.
Now let me say, and I've got to declare my interest and my association here. You've got to be totally transparent. I am an honorary Calabrian citizen because of my services to the bergamot fruit. I was actually given the award in Calabria about 10 years ago. And I do all the research with the Italians on what I believe is the best natural product in the world, which is a bergamot derivative from oranges grown in Calabria. Now, the thing is BJE 100, that's the extract. I'm not allowed to mention the product on any public forum like this. And I think everyone should be taking this BJE 100, one tablet twice a day, which is basically the juice of the orange put into a pill made in Australia. So they get the desiccated oranges from Calabria, bring it to Australia, make it here. And I've been using this stuff in my patients and personally for 15 years, and it has so many active properties. So what it does, going back to cholesterol, it doesn't lower cholesterol, but it shifts you from small LDL to large LDL, small HDL to large HDL. We have published data on this. It makes your statins work better at a lower dose if you use this. So that's another really important part of what this stuff does for you. It reduces your risk for diabetes, for fatty liver, for Alzheimer's disease. It suppresses cancer stem cells. That's stuff that came out of the University of Manchester, not our lab in Calabria. So to me, the bergamot extracts, the BJA 100 twice a day is probably the best natural product in the world that all people over the age of 50 should take twice a day for the rest of their life, and especially if you have cardiac disease or you're on a statin or you've got metabolic syndrome, which is the actual clinical presentation of insulin resistance. So there's the first one. The next one, again, I'm the chairman of the scientific advisory board for a company called Canica, and they make the active ingredient ubiquinol. Now, what is ubiquinol? Ubiquinol is the active component of coenzyme Q10. So when you swallow a coenzyme Q10 tablet ubiquinone, it has to be converted to ubiquinol when it gets into the body to do its stuff. And here's the problem. When you hit 50, the enzyme that does that conversion starts to drop off. So I take the active ubiquinol. I take it just to give me energy, but statins pulverize the way ubiquinol works in a thing called complex 3 in the mitochondria. So I give it to all my patients who are on statins to stop them getting the muscle aches and pains that some people get from statins, and also the other effects of statins as well, the collateral damage of statins rather than the benefits of statins. Ubiquinol helps minimize that. And I also give it to people with heart failure, 300 milligrams a day, just to improve their cardiac function. So that's ubiquinol. Then there's kyolic garlic. Now, kyolic garlic, a mate of mine called Matt Budoff, who's one of the top preventative cardiologists in the US, has done a study where he gave people 4 kyolic garlics a day who had proven coronary artery disease on a CT coronary angiogram, redid their CT angiogram 18 months later, and he'd reversed the disease with the kyolic garlic.
What's kyolic garlic? What is
Kyolic
that?
garlic is very concentrated aged garlic in an extract.
Right. Okay.
So, and it has the active component of garlic in it, which helps pull fat out of the arteries, lower cholesterol a little bit. Certainly, two of those a day is very good for lowering blood pressure, for example. So 2 kyolic garlic a day. So I'm giving the ingredients, not the names of products, because I can't mention the products. Now, I also use a thing called magnesium orotate aspartate, because those two things lift the CoQ10 up in the mitochondria. And then finally, the fifth component for the things that I specifically use for cardiac disease, I'll get onto other supplements in a second, is a combination of vitamin D and K2, which basically takes the calcium out of your arteries and puts it back in your bones. So you get 2 bangs for your buck. You get more flexible arteries and stronger bones. So they're cardiac specific things. But then there's more general things for good health. And the general things for good health are a good quality multivitamin. We haven't even got onto this yet. But the problem is most multivitamins sold around the world and in Australia have inactive forms of B vitamins in them. So inactive folate is folic acid. And I don't think folic acid should be in any vitamin at all. I think it all should be the activated forms of folate, because this bypasses the MTHFR gene, which we haven't even mentioned yet, but also activated forms of B3, B1, B2. And here's the problem, B6. There's been all this thing about pyridoxine or B6 causing problems. It's because most of these supplements use these inactivated forms of B6, and about 10% of people can't metabolize that to active B6, and they get the peripheral neuropathies and all the concerns with that. So I think people should be taking a good quality multivitamin that has activated forms of B group vitamins, not the inactive. And there's only 1 or 2 of those in Australia. And again, I can't mention them in these forums. And also some form of omega-3. So whether it's krill or high potency fish oil, I think it's a good thing.
Mm. So you mentioned the MTHFR gene. Talk to us about that. Why is that important?
It's very important because 50% of people have a mutation in this gene. So 1 in 2 people are affected by the MTHFR gene. They're born with this mutation. So there are 2 basic mutations. There's what we call the C allele, which is the worst one, and the A allele, which is not as important. So I'm homozygote, which means I've got 2 copies. So you'd know this, but how do genes work? You get 1 copy from mum and 1 copy from dad. So every gene is paired. So with that, you can either get either 2 normal MTHFR genes or 2 Cs, 1 C, 1 A, 2 As, or a C and an A. So they're the different varieties of MTHFR. And there's a whole lot of other spin-offs. So if you have extensive genetic tests, you can get many different genes in the MTHFR gene pathway. The MTHFR gene is really the gatekeeper for how folate is incorporated into into DNA, RNA, and protein. And when you get over 50, if you've got one of the mutations, say the one I've got, it pushes up your homocysteine level. And homocysteine is a toxic amino acid that damages blood vessels. So you want to get the homocysteine low. So I look at everyone's MTHFR gene, their B12, their B6, their folate levels, and then I will give them activated forms of B vitamins around what I see on that. And so by doing that, then I think we can have a profound effect on people's ongoing cardiovascular risk. But again, my colleagues don't believe in all this because they gave B vitamins to people with high homocysteine levels, and it didn't affect their risk for stroke because they were giving them inactivated Bs. They weren't using the right type of B vitamins. And I think once we start thinking more along more sophisticated versions of these things, then we're going to be a lot better at this. And one of the big things, and David Sinclair is really the pioneer in this area, is activated B3. So we've everyone knows about niacin. If you have a bowl of Weet-Bix, you get 20 milligrams of niacin. So it stops you from developing a condition called pellagra, which is a B3 deficiency. Big deal, because no one has a B3 deficiency in our society if they eat normal food. But what we're finding now with activated forms of B3, whether it's the old style one, nicotinic acid, whether it's NMN or NAD riboside, what these things are doing are really revving up the mitochondria and stimulating a group of chemicals called sirtuins, which are the gatekeepers for many reactions in the body. So when life's going along swimmingly and there's no stresses, your sirtuins are working pretty well. But if things are going wrong in the body, you need your sirtuins to be working well to try and prevent the damage, which then accelerates your aging. And that's where this NMN comes in, is stimulating the sirtuins, and it's working as an anti-aging supplement. And there's a lot of evidence now that in experimental animals and in human cells, that NMN is very important. So taking NMN is a very important thing to do as well. So I think these activated B vitamins are very, very important.
Yeah, I've been on NMN for 6 years now, I think.
Yeah,
So, yeah.
me too.
Yeah, I find it very beneficial. What about wearable devices, Ross? What do you think about those? And do you think that they're helping to prevent heart disease? Are they catching things earlier than
I
before?
think they're good. I often tell my patients you should be smelling the roses, not analysing them. But I don't have a problem with people having wearables. I mean, for example, there's the CGMs, the continuous glucose monitors, have really revolutionised the management of diabetes. So without people having to prick their fingers all the time and get their sugar levels, you just put a thing on your arm and wear it for a couple of weeks. It wears off, you put another one on. And it's telling you what your sugar's doing. And it's the wonderful thing about that. It can tell you what foods, in your case, are pushing up your blood sugar. And that's the thing, that one size does not fit all. So what might affect your blood sugar may not affect mine, or vice versa. And that's what the CGM tells you. So the more typical wearable devices like the Apple Watch or the Samsung varieties that can do ECGs, I found them very useful. I was on a plane once from Sydney to Bangkok, and a fellow was having a cardiac episode, and he was just lucky that I was on the plane. So I took my Apple Watch off, put it on him, got an ECG, could make the diagnosis, organise treatment, which we had on the plane, and he was fine. And so that they are very good. And we're just getting to the point with these more sophisticated versions of wearables. We can look at people's sleep patterns, their stress patterns, their heart rate. Even now, we're getting to the point some of these wearables will be able to measure blood pressure, so real-time measurements of blood pressure. So I think it's a good thing. But again, I don't want people to get too fixated with this stuff. As I said, smell the roses, don't analyze them. And so we can go overboard with charting things, and it does my head in when a patient comes in with a file that thick of all the stuff they've been monitoring, and they're not living their life. They're just spending their whole day monitoring themselves, which I think is a bit of nonsense.
And some people get stressed about the data as well. I know at my gym, they had a challenge they rolled out in association with a particular wearable. I won't name which one it is. But when people started to monitor their sleep, they started getting stressed and staying up late because they were worried about whether they were getting the right amount of sleep, quality sleep, and so on, and was stressed the next day because the wearable was telling them that they had a bad night's sleep, yet that they felt that they had a good night's sleep. So
Yeah.
it can be a bit counterproductive sometimes.
Absolutely, and I think wearables help some people and they make other people worse, which is what I was saying, one size does not fit all.
Yeah.
Just as long as you don't overdo it. We don't need too much data. We want data, there's nothing wrong with data, but just don't go overboard.
Mm. Okay, so if you had to strip it back, what are your absolute non-negotiables for keeping your heart healthy?
Oh, 5 keys, easily. So the 5 keys, absolutely non-negotiable, and also having a regular assessment with a trusted physician. So all males at 50, all females at 60, if they have no major risk for heart disease, should have a coronary calcium score. So, and people say, oh, what about the radiation, doctor? The radiation's dreadful. Yes, there are 3 advantages of being over the age of 50, Azra. Number 1 is wisdom. Number 2 is grandchildren if you have them. And number 3 is you lose the cancer risk from medical radiation, which is why we start assessing people at age 50. So if women start having mammograms at age 40, it's my opinion, unless you've got a rampant family history of breast cancer, that the angiograms increase your risk for breast cancer more than they detect breast cancer. But from 50 on, no. And it's the same thing with coronary calcium scoring. So 30-year-olds should not be having coronary calcium scoring unless there's a very good reason. So, for example, I've got a 32-year-old woman whose father died at 31 of a heart attack, and she's already got a muck of bunch of calcium in her arteries at her age. She needs aggressive statin therapy, et cetera, because she's got a severe cholesterol genetic abnormality that needs to be treated with pills. Okay, so that's an exception, but males at 50, females at 60 as a general rule, and I shift the goalpost based on assessment of cardiovascular risk from other means. So I think that having regular assessments, and I'm starting a thing, this is just a shameless plug, but I'm starting a thing this year called W Life. So W for Walker, of course, but Double Your Life, which is an anti-aging service where we'll be doing comprehensive blood tests, genetic screening, and also total body scanning to find out exactly where someone is right now. I call it the billionaire's assessment. It doesn't cost you $1 billion to have it done. But all of these things will be done so we can get a great picture of what your health's like and then give you a 15, 20, 30, 40, 50-year plan to keep you well over that time. Because you can pick up early subtle changes in someone in their 40s and 50s that will not affect them now, but if they start making changes now, they won't affect them by the age of 65, 70, 80.
Yeah, for sure. Well, we'll get the details off you on that, and we can pop it in the show notes if the platform's up already. But you're also bringing out a book, I believe. Is that right?
Well, I've written the book, but I can't get a publisher. It's called Health Span, and the problem is the publishers are saying, look, no one's reading non-fiction books these days, especially in the health space, because they just get all the information off AI or on the internet. So people aren't that interested in books. So the books, they're ready to go. If there are any publishers listening to this, you've got a great forum for promoting it, because I've got a national radio show every week. And it'll sell, I think, a lot of copies, but I don't want to self-publish it. I'm just too busy for all that sort of stuff. I want someone to promote it for me, but no, so Health Span's there. I'm just waiting for someone to take it up.
Yeah, well, hopefully that will happen. All right, final question for you, Dr. Ross. What does it mean to you to live well longer?
Well, look, can I tell you, my major motivating force is that I have been married to this beautiful woman for 49 years, and we have 5 children, 9 grandchildren, and I want to be around for them for as long as I can. And also my job, Azra, as a cardiologist and as a preventative health expert and as a media presenter, it's a privilege. It's a privilege to be able to affect people's lives. And I have people almost every day say to me, "Thank you, doctor, for everything you've done." My wife and I were having lunch down at a local cafe in Sydney yesterday, and this fellow walks up to me. He's been a patient of mine for 25 years. He said, "Oh, Ross, I want to introduce you to my wife," and she said, "Thank you for giving him an extra 25 years of life." Now, can life get any better than that? My life is a privilege. I just want to keep it going as it is. And for as long as I can. So I'm having my 70th birthday this year, and I want to keep going for another 30 years at least.
Fabulous. Well, congratulations on getting to your 70th milestone, and thank you for everything that you do and helping to support people to live well longer. And thank you for joining me on the podcast tonight, Dr. Ross. Thank you.
My absolute pleasure. Thank you very much, Ezra.
Well, that's a wrap for today's podcast. Thank you for tuning in. And if you'd like to learn more about biohacking, go ahead and sign up on my website at www.biohack-her.com to get a free copy of my 5 top biohacks to get you kick-started. While you're there, you can also check out my blog page for more tips on biohacking. If you'd like to subscribe to this podcast, you can do so on Apple, Spotify, and Google Play. Let us know if there's anyone you'd like us to talk to in particular, and we'll endeavour to get them on the podcast. Until next time, remember to live well longer.